All right, and good afternoon, everyone, and welcome to our Baptist Health three-part virtual series titled Your Path to Healthy Living, brought to you by our Baptist Health Partnerships Department here. Through this department, if you're unfamiliar with it, we at Baptist Health are able to bring medical resources and programs such as this one, virtually and in person, to the community in collaboration with our various community partners, such as the First Coast YMCA and the Jewish Community Alliance, to name a couple. So my name, to introduce myself, is Michael, and I am the manager of our Baptist Health Partnerships Department.
And I'm Aris Sastre, go by Aris Sastre. I'm a family medicine physician at Baptist Primary Care in Bartram Park, and also medical director for the YMCA Healthy Living Centers in the Jewish Community Alliance Wellness Connection.
Dr. Sastre, I want to thank you so much for joining us today and being our special guest speaker as we kick off this virtual series. So for those of you tuning in, what we're going to be doing is focusing over the next 3 weeks. We'll be diving into a few different topics that will look at tips and resources for a healthy lifestyle. We're kicking off a new year. It's 2021. We want to leave everything behind us in 2020 and move forward on a positive note and on a good footing. So we're kicking off today's session talking about the importance of knowing your numbers. And when you hear me say know your numbers, you're probably wondering, what is he talking about? What numbers are we going to be looking at? And trust me, we're not going to be looking at the scale or talking about those numbers if that's what you're thinking. But we will be talking about some of the numbers that can tell us a little bit more, and especially your medical professional, tell them a little bit more of how your health is doing internally, such as cholesterol or blood glucose or blood pressure, just to name a few. So Dr. Sastre, being a family medicine practitioner and seeing people day in and day out in your practice, you work with these numbers a lot, don't you?
Definitely. This is kind of the bread and butter of what really helps us figure out maybe what's going on internally with somebody. And really some of these things are just leading indicators, in addition to our physical examination with people, but just also kind of give us some information early on into the course of disease, or even what we might be able to do preventive-wise to prevent progression to certain diseases like cardiovascular disease and diabetes. So definitely these numbers are important. It's something we look at every day.
Great. Could you tell us a little bit more on the main numbers that you as a primary care physician are really looking at that you want to, I guess, the tip of the iceberg, the main ones that are of importance to you when you first see a patient?
Sure. I think there are plenty of numbers. There's numbers we deal with every day, but I think there's 5 that I would focus on that I think everyone should know for themselves. Because it really kind of gives you a glimpse into maybe your overall health and be able to help us predict maybe where things might be 5-10 years from now, and help you kind of make those right dietary and lifestyle decisions. Sometimes it's medication decisions with your physician as well. But I would say 5 things, and I'll go into these a little bit more in depth. One would be fasting plasma glucose. Second would be blood pressure and knowing what is normal, what yours is at. Say the third thing would be a waist circumference. Fourth would be your cholesterol numbers and kind of being able to understand what each one really means. And there's a fifth one, which you may not be aware of, and some people, this is somewhat new for them, would be a 10-year cardiovascular risk score. And this is kind of something that we've been incorporating over the past 3 to 4 years to help predict maybe someone's overall cardiac risk. And once you have your other numbers, you'll be able to calculate those. But without those numbers, that's something we aren't able to do. So just thinking about these numbers, I figured it'd probably be a good idea to start off with a real patient, somebody I had seen maybe about 6 or 7 years ago, and just kind of, maybe you can kind of think or maybe relate to this person. But I'll go over some of just his basic history and basic numbers, and then kind of hopefully by the end of our discussion here, you'll be able to kind of see maybe where he was at and where he moved to after that time. But basically, this was about, several years ago. It was a new patient, 38-year-old male, about 218 pounds, BMI in the 35 range or so. And, he wasn't very active at the time, wasn't really watching his diet. we reviewed some of his numbers. His LDL cholesterol was about 135. His triglycerides were almost 200. Fasting blood sugar was about 108. And we happened to check his waist circumference. He had one of these screenings for his company, and he had about a 38-inch waist. So just kind of keep those numbers in mind as we go through this, because it'll kind of help you to know, are those good numbers? Are they not? Blood pressure was normal at the time, but it was at the higher end of normal. We'll just put it that way. So I'd say first thing would be the fasting plasma glucose. And normal glucose is between 65 to 99. And they consider fasting as not eating anything for 8 hours prior to that blood test. You can drink water, but in general, it's no food for 8 hours. And if someone is between the 100 to 125 range, they would say that's in the prediabetes range. There's also some other names you might hear, impaired fasting glucose or IFG might be discussed, or you might see that on a problem list. But that's generally where someone is at higher risk of developing diabetes in the future if you're in that 100 to 125 range. Greater than 126 or greater would be considered in the diabetes range. Normally, you have to have two readings separated apart where they're both 126 or higher before we would classify someone as having diabetes. So we can't just use a one-time reading, but that does make us a little bit more suspicious that might be going on. So this is important because we're seeing that the amount of people in the pre-diabetes range with 100 to 125 is rising significantly in the US right now. And the American Diabetes Association said that for people who are in that pre-diabetes range, just a 7% weight loss will reduce your risk of developing diabetes by about 58%. So really knowing if you're in that range can make a huge difference as to the trajectory where you go. The other thing is when we start to see that fasting glucose is elevated, you know that your pancreas is already starting to experience some beta cell damage, which does create insulin. So that's one of those things, and there's likely some insulin resistance. So really being able to track your fasting plasma glucose number over time can help you identify when there's a problem and when you really need to be jumping on it to prevent developing diabetes. So that's number one, I'd say, the glucose.
Now, if I could ask a quick question, Dr. Sastre, how often should one be looking at that number when it comes to your fasting glucose, so that way the pancreas isn't overwhelmed, and if someone's able to turn that number around, how often should they be seeing this?
That's a good question. So first of all, if you go by the official guidelines from the U.S. Preventative Services Task Force, they recommend that pretty much everyone be tested for diabetes starting at age 45, about every 3 years. However, a lot of the guidelines recommend that if you have any risk factor, which might include family history of diabetes, overweight or obesity, signs of insulin resistance, these could be skin changes, different things that we see, that you probably should be screened earlier. So we're actually even screening children now, just given the obesity epidemic. So a lot of it depends on your overall family history, body makeup, and whether or not when you do have that test done, if it's normal. A lot of times what we're trying to do now is for patients who might have blood glucose readings in the pre-diabetes range, trying to be a lot more aggressive and really monitoring it sometimes every 6 months, no later than every year, because it's something that you really don't want to let go for years and years if you're able to jump on it ahead of time. So it's very, very individualized, but at a minimum should be done at age 45 if someone's never had that done, but ideally a lot earlier if there's any of those other risk factors.
Great. Thank you.
Sure. And so the second thing we can kind of go on to is blood pressure. And this is a common thing and a big discussion I have all the time, week to week. A common thing I get from patients, I'll come in and say someone's blood pressure is 150 over 90. And I'll say, wow, your blood pressure is pretty high. And I'll get the answer. It's usually sometimes an older individual will say, oh, you know what? That's my normal. That's my normal blood pressure. My doctor's always told me that's good for me. And that's really not, there isn't a good for you number. There are guidelines, and the guidelines are there on blood pressure for a specific reason. So, back in 2017 was the biggest change in blood pressure guidelines since 2003. And a lot of this was derived from a big review of over 900 studies that looked into blood pressure and risk of heart disease, of heart attack and stroke, and basically another big trial called the SPRINT trial. But that looked at specific outcomes with respect to blood pressure. So for years, we had considered there was a pre-hypertension range, there was a stage 1 and stage 2 hypertension range, and it really didn't start until 140/90 from when we considered high blood pressure. But that's all kind of been changed based on some new data. So this is evidence-based data. It's not just guidelines made up from a bunch of experts. Now, there were experts on this panel, but they looked at years and years of data. So they consider normal blood pressure is less than 120/80. And elevated blood pressure, they've kind of removed the term pre-hypertension. Elevated blood pressure would be anyone between 120 to 129 systolic. And that's the top number, which is basically the pressure your heart sees with pumping. The diastolic reading should be under 80. So that's considered elevated blood pressure, 120 to 129 over anything less than 80. Stage 1 hypertension starts at 130/80. And that's new because that used to be a lower level, but that's stage 1 is 130/80 to 139/89. And then stage 2 hypertension is at 140/90. And part of that was derived from data that showed that even a 10-point incremental difference in that blood pressure made a significant impact on reduction in cardiovascular and cerebrovascular complications. So that's kind of what you need to know. And the best way to check blood pressure, a lot of people ask this, is like, what time of day should I check it? When should I do it? Really, it's when you can give yourself about 5 minutes to where you can sit quietly. Usually they say using a chair that has a back to it with your feet flat on the ground, quiet, not speaking, and ideally probably an upper arm cuff that fits appropriately. If it's too tight, you're going to get a higher than usual reading. Too loose, it might be a lower. So that's a very important number to know. And to know that, in the past, you may have heard different guidelines on blood pressure. Even before 2003, they allowed even higher blood pressure readings. But the new set of guidelines is based on good clinical evidence with those numbers. So.
That's a lot a lot of information to take in, especially with blood pressure. Correct me if I'm wrong here, Dr. Sastre, is constantly changing throughout the day, right? So whenever taking it, we want to make sure that we're seeing it when we're relaxed at best, but also that high blood pressure reading, or maybe an elevated blood pressure reading that you're referencing, that's not just based off of one reading, one instance, and then all of a sudden I'm diagnosed with elevated or high blood pressure. Is that right?
Right, that's correct. Really, and this is something that we try to do in our offices is, it's very difficult sometimes in a busy office situation. You might be seeing a specialist, you might be in our office, and really we need to take the time to wait for at least 5 minutes till we check it. And often if we have somebody who's in the stage 1 hypertension range, that 130 to 139/80 to 89, we don't, first of all, put that on their chart immediately after one time. This is something we kind of monitor over time. It doesn't necessarily mean you're going to be on medication right away, but it's one of those kind of flags that says we need to monitor this. And usually what they recommend now, this is somewhat newer too, is that if someone does have an elevated reading, it's probably a good idea for them to consider purchasing a cuff and monitoring this at different times at home over the course of 3 months. In some places, they do ambulatory blood pressure monitors that will automatically do that for you. In certain countries and in Europe, they actually do that frequently, where they will give people a machine to monitor at home and bring that back. But here, as machines are pretty readily available, if you have an elevated reading, we encourage people to work on diet and lifestyle and monitor over the course of 3 months and kind of average out those readings to give us a better picture as to what's going on most of the time. I mean, you can have a bad day, be very stressed at work. You could have just drank a 32-ounce Starbucks or something and come into the office and have a high reading. You could be on Sudafed because you have a sinus infection, and all those kind of things affect blood pressure. So we try to at least give people the benefit of the doubt and monitor it over time.
Right, right. So that's good to mention because you are so right that there is a lot of factors that can go into blood pressure, elevate it, bring it lower, and it's constantly changing. So that's something that we certainly like to work with people on and encourage people to utilize our community wellness centers for, and our health coaches for helping them monitor their blood pressure, see what their numbers are at, and if you're working through, learning some breathing techniques, if you will. I know that we see oftentimes, and I'm sure you do in the office as well, is that, as soon as that cuff comes out, the heart rate starts racing, the anxiety goes up, and it's like, what's the number going to be?
Mhm.
So how can we calm our minds and calm our heart rate, so that way we can get more of a true blood pressure reading, and hopefully not see those numbers go up the way that we were anxious to see and anticipating. So good.
And going on to the next thing, I would say the next important number to know is your waist circumference. And this is something that is not done real often. We usually do it about once a year in our office. Most of the time, it's one of these requirements. If you've ever done one of these work screenings, they ask for fasting glucose, cholesterol, and waist circumference. And they think that waist circumference may even be more important than body mass index in determining potential future risk. So they say if you carry a lot of centripetal weight or weight around the waist, that's kind of an early sign of insulin resistance, sometimes higher cortisol levels, things that kind of put you at higher risk for cardiovascular disease. So the number to look for is, for men, ideally you want a waist circumference less than 40 inches, and for women, less than 35 inches. And this is important because when you look at a whole picture, and we'll talk about this a little bit later, but there is something called metabolic syndrome, and waist circumference is taken into that calculation, or that kind of determination as to whether or not someone might have metabolic syndrome, which places a higher risk for diabetes and heart disease.
And Dr. Sastre, just to probably debunk some of the questions we might receive, and I do want to, I know we're already a few minutes in, but I do want to encourage any of our viewers, if you have any questions for either myself or Dr. Sastre, to please post them in the comments and let us know. We'd be happy to answer those for you right here. It looks like we have Diana who's tuning in, and she says, "Hello, Dr. Sastre and Michael. Really great information. Thanks, Diana. We really appreciate you joining us today, and please let us know if you have any questions about the information that Dr. Sastre is sharing." So to debunk some of what people might be thinking, when you say waist circumference, you mentioned it's center mass. So we're not talking pant size or hip circumference, which would be much lower than your waist. Correct?
Right, that's correct. A lot of times people, there's a lot of discrepancy as to how people measure their weight, and it's not a waist. It's not necessarily your pant size you're wearing. So this is something usually they can do that in the office, and we use a tape measure and do it that way around the central portion of the waist. So.
All right. So that's good to know. I know that sometimes you can be like, well, I'm a 32 pants, so I should be okay, right?
Right, exactly. Yeah, if you wear your pants a little low or a little too high, you may not give you an accurate reading. So.
All right.
So far we talked about the fasting blood sugar, the blood pressure, and the waist circumference. The fourth thing I'd look at is cholesterol, and this has kind of changed a little bit. And part of this, initially people would say, well, my total cholesterol is just a little over 200. I'm not really worried about that. But you really need to know your individual numbers, because you can have a 200 cholesterol and be at high risk, and you could be also at low risk or less than usual risk. So total wise, I guess one of the changes with some of these newer guidelines is they're actually saying less than 170 is an optimal level. Traditionally it's been 200, but less than 170 is probably even better. But I would say the key things would be looking at triglycerides. So triglycerides by themselves at high enough levels do pose a potential risk of causing atherosclerosis or plaque buildup in the arteries. That one at normal levels considered less than 150. So anything higher than that could mean that you're at slight increased risk. Definitely over 399 might suggest that there is some familial triglyceride disorder that needs to be addressed as well. So sometimes levels that high or higher may need medication in addition to diet and lifestyle changes. The second would be the HDL, or the good cholesterol. So good cholesterol is probably just as important as the bad cholesterol. Now, the thing is, the good cholesterol for women ideally should be at least over 50, or HDL. For men, it should be at least over 40. So having very low good cholesterol can be just as a higher risk factor for heart disease as having a high bad cholesterol. So that's something that would make a difference. So that total doesn't come into play as much if you have like a very low good cholesterol. LDL, which is bad cholesterol, it's somewhat confusing for a lot of people because that number has been a moving target over the years. Should it be under 130? Should it be less than 100? Does it need to be under 160? I would say an ideal range, what most people should target for, is less than 100. Now, it's different if you have different circumstances. So someone who has already known history of vascular disease, whether it be heart disease, peripheral vascular disease, carotid artery, they generally target for lower levels, less than 70, between 40 to 70 on medication. In general, for patients with diabetes, less than 100. But I'd say a good target for LDL is generally less than 100. LDL number is important to know as well, because if you have very high levels, generally 189 or higher, there's a very high suspicion that you may have a familial hyperlipidemia, and that is a independent risk factor for heart disease by itself. So that's something that often needs intense diet, lifestyle, and often medication if it's going to be higher than 189, and there's no way to get it down with diet and lifestyle. So I'd say LDL less than 100, triglycerides less than 150, and HDL, depending on male or female, greater than 40 for men, greater than 50 for women.
All right. Could you explain, Dr. Sastre, just in your best way, the difference between what is bad cholesterol, what is good cholesterol, and what are the triglycerides? It sounds they're all related, but they, as you just explained, they all play different roles in risk factors.
Right. Well, there are actually many cholesterol particles. Several of these which we actually don't measure in your traditional lipid panel. The ones that most people know about are the LDL, triglycerides, and HDL. But there are many particles similar to LDL, which are known that in higher levels and under certain circumstances can start depositing plaque in different parts of the body. Basically, there are a number of factors that can contribute to that. So just general inflammatory states in the body can contribute to some of this plaque getting deposited onto the arterial walls. So things like autoimmune diseases, obesity by itself increases some inflammatory markers, smoking. These kind of things factor into some of these particles forming like plaque or thickening on the arteries. When you hear thickening of the walls of the arteries, that's what happens. HDL is important in trying to shuttle some of these bad cholesterol particles for processing out of the body so they don't stay circulating into your bloodstream. Triglycerides are a little bit of a different, they're smaller particles. They are related to different dietary factors. One of the factors that we look into is actually high blood glucose. So high blood glucose tends to form these small fat particles, and those by themselves can cause plaque buildup over time. They also can kind of overwhelm other organs, such as the pancreas. That's a big risk factor for something called pancreatitis if you have these high, small fat particles that build up. So they're all slightly different. The HDL is definitely very important. Even the type of HDL, there's different types, is important in terms of shuttling some of these bad cholesterol particles out of the bloodstream, preventing them from being deposited in arteries and then getting out of the body.
Wow, thank you. That's good information. So it kind of sounds like an example that I heard or read a while back with HDL and LDL cholesterol is it's like your LDL cholesterol is your trash that you set out at the end of the street every week, and your garbage man is the HDL good cholesterol picking it up and taking it away.
That's one way to put it.
So I actually have some questions here. If I could read them off to you, Dr. Sastre, that had come through. Diane asks, are there any natural remedies that help people manage high blood pressure in addition to exercise and nutrition? There's lots of questions out there about natural remedies.
Well, I would say the first thing to start, without having to take supplements, would be looking at your diet in terms of different nutrients. So, number one, one of the biggest targets we look at is sodium. So that, in general, the American diet is probably not ideal in terms of sodium intake. They know that on average, depending on men or women, men might eat upwards of 3,000 to 4,000 milligrams of sodium per day. Women tend to be a little bit better when they've done some dietary surveys. But in general, pretty much watching the sodium intake, no more than 1,300, 2,500 milligrams per day is ideal. Potassium intake in the diet is also important. So in general, low potassium diets contribute to high blood pressure. So they're saying that increasing potassium-rich foods, things like peaches, bananas, oranges, tomatoes, those kind of things might help combat high blood pressure. There are some other natural remedies in terms of supplements and things that may help to reduce it. I think some of these may work by effects, sometimes even like a diuretic effect where you might lose some of these the electrolytes or sodium, so that way you can kind of lower blood pressure. Hard to say if I'd really recommend those, but I'd say probably off the bat, one of the biggest things would be looking at potassium and sodium intake in the diet. So.
And when you say potassium intake, you're mentioning that it's much more recommended to get that from the fruits and the vegetables that are high in potassium, rather than going straight towards a supplementation.
Right, I agree, and I think a lot of this too, you do have to discuss with your physician, because there are some cases where someone who, like for instance, someone who has chronic kidney disease, they might be on a potassium restricted diet for certain reasons, but in general, getting it in the food is probably going to be the best source of improving your potassium and blood levels and blood pressure.
Okay.
So.
Thanks, Dr. Sastre. And Diana, I hope that answered your question on natural remedies. And an additional resource that is available, as I feel that this might be a right time to share with our viewers, is our wellness centers throughout Jacksonville have health coaches available to you that can work with you on resources as well as wellness coaching to work through any personal health goals. If you're looking to improve your numbers that Dr. Sastre is discussing today, our wellness coaches are available to give you an update on those numbers. Anyone 18 and older can get a baseline screening once per year, and we can give you an update on that. And that would include some of these numbers, such as your cholesterol that Dr. Sastre just shared on, as well as your triglycerides and blood pressure and blood glucose. And that's a service that Baptist provides at no cost to the community member, and we can do that once a year for you. So if you're interested, we have our contact information shared in the details of this video, and you can call us and reach any of our any location close to home to you at 904-202-4500. Dr. Sastre, before we continue, I do have another question here from Deborah. She asked if you can quickly repeat the elevated and high levels for blood pressure.
Sure. So elevated blood pressure would be the systolic, or the top number, between 120 to 129. And in general, the bottom number has to be less than 80. High blood pressure would be over 130 or higher than 80 for the top number, or higher than 80 for the bottom number. That would be considered stage 1 hypertension. And then stage 2 would be 140 for the top, or 90 or higher for the bottom. So if the top is 122 but the bottom is 92, technically it's in stage 2 hypertension. So it's whatever the higher number is, the top or the bottom. So hopefully that answers that.
Thanks, Dr. Sastre.
Sure.
And Deborah, if you have any additional questions, please feel free to post them in the comments. We'd be happy to help.
Sure. And then one last thing I could talk about, I don't know if, I think they posted the link on there, is that the last number would be that 10-year cardiac risk score.
Yes.
So to do this score, this is something that basically is based on something called, the American College of Cardiology has developed this tool based on 5 different cohort studies looking at cardiovascular outcomes over years. So if you have your numbers, which basically is your blood pressure, your cholesterol numbers, you can actually plug in your numbers into this calculator, and it's free to the public. Anyone can use this. It actually also asks things like age, ethnicity, gender, smoking history, they ask if you have diabetes or take medicine for hypertension. it will give you a predicted 10-year risk of a heart attack, or basically atherosclerotic vascular disease. And this can kind of help classify you as to either someone at low risk, borderline, intermediate, or high risk. This is only for people aged 40 to 79 who have not had a previous history of heart disease or vascular disease. So this would be just a general screening tool. And what this does, it helps you and your physician figure out, depending on what level of risk you're at, is the best thing going to be diet and exercise? Is it going to be diet and exercise plus, you might need to be taking medication, or do you need some additional testing to help further stratify you into one of those categories? So this is a relatively new thing that we've been doing over the past 3 to 4 years, but it does help us kind of classify someone's level of risk a little bit more accurately than we have before. So just taking into account other factors such as gender and age and ethnicity.
That's great. So it allows you to work with your patients on a more a custom treatment plan in relation to their personal situation, and it's great to hear that it does allow or open up the door for what are the natural or lifestyle modifications that can happen. Is it exercise and nutrition related? And I mean, I'm sure patients are happy to hear that they don't need to go on medications. It's something that they hold the reins on, that they can adjust themselves.
Exactly. And it really gives us an opportunity. It's a discussion point. It allows us to kind of say, okay, your risk is here. Let's see what you can do. Can you lower your overall risk? And sometimes it's as easy, they'll even show you on that calculator. If I have a patient who's a smoker and it says they have a 8% risk of heart attack in the next 10 years, but if they quit smoking, it drops down to 4% or 3.5%. That empowers them to know, okay, hey, if I make this lifestyle decision, I don't need to take medication. I'm going to cut my risk in half or even less than half. My blood pressure drops 10 points. I even drop it lower. So it really gives you an opportunity to see what you can do and how it might reduce your risk over time.
Wonderful. Sometimes it's just knowing that's half the battle, and then the second half is finding the resources for it.
Yeah. Well, I'll give you the story about that patient again, just to kind of wrap these up, because I know we talked about a lot of stuff today, but remember, he had the weight of 218 pounds, the glucose of 108, LDL cholesterol 131, triglycerides just over 200, and the waist circumference at 38. So he had a lot of risk factors, pre-diabetes range, high triglycerides, overweight. Well, I didn't see him for a little while. We did talk about diet and lifestyle changes, and I was surprised, actually. The next time I saw him, he had dropped almost over 40 pounds. He was down to 172 pounds. And we rechecked some of his levels, and his LDL went from 130s down to 105. Triglycerides went down to the 90s. His fasting sugar dropped to 78. Waist circumference had dropped a couple inches. He picked up doing some long distance races. So I don't necessarily recommend everyone start doing marathons, but he took it very seriously and went from someone who is at high risk for cardiovascular disease and developing diabetes down to average or normal risk within a matter of 6 to 8 months. So it kind of empowers you to be able to make some changes to kind of change the trajectory about where you're going. And we only have a limited time, as many people know, in the office. So that's why having you and health coaches through the YMCAs and the JCA really help us to allow that more detailed guidance in terms of making dietary and lifestyle changes. And even now, some of the tools that we have in helping people with meal planning and things like that are going to come into effect. So.
Yeah, and that's the wonderful piece of the partnership, and really what we're able to do as physicians and wellness coaches in the journey of helping others with their health journey is we can be that accountability partner, and those wellness coaches can be the ones to walk alongside each individual patient on what their goals are. And that's quite impressive for your patient to take it really to heart and put it into perspective of, we all have the opportunity to turn our lives around at any corner or any turn. It's just how how much do we want to push on the gas pedal to make it happen? So he made it happen in 6 months, which I'm sure we've seen folks who have patients who have made it happen sooner, or maybe taken a little bit longer, and they still see the results of positive health change and reducing risk for diabetes, stroke, heart disease. So it's quite impressive. And yeah, being on the education side of things with wellness coaching, it's impressive how we have the opportunity to work with patients that are either referred by their primary care physicians, such as yourself, Dr. Sastre, or individuals who are just looking to make those lifestyle changes and are seeking a resource or guidance. And we have the opportunity to work with them, find those resources, teach them techniques, how to apply this into their daily lifestyle, because we're all individual. We all have different barriers or stressors, but we also have different strengths. And that's the cool thing about working with patients is, as a wellness coach, and I'm sure as a physician, to be able to pull on those strings and teach them how to create those goals. So it's quite a great venture that we have going. I think we have another comment here. Have some thank yous from Deborah. It looks like we answered her question as well from Rita. So if anybody has any last minute questions, please feel free to drop them into the comments here, and we'd be happy to answer them. But as you do, type out your questions. We'll go ahead and start closing it out just with some last information, and if you get your comments in, we'd be happy to answer them. So for information on Dr. Sastre's practice, scheduling with him or his office, as well as information on our various Baptist Health Community Wellness Centers partnered with either the YMCA or the JCA. We also have locations located around Jacksonville and the north side of the city, Riverside, Mandarin, Nocatee, Ponte Vedra. You can connect with us in any area. I want to thank you all for tuning in to our first session of the Your Path to Healthy Living. So if you're around for next Tuesday, we'd love to have you join in for our second installment. That's going to be next Tuesday, February 2nd at 1 p.m. And we'll have two of our Baptist wellness coaches discussing some simple habits to make a big difference in your sleep and stress. So mark your calendars and join us back here next Tuesday, the 2nd at 1 p.m.
Thank you all.
Thanks everybody.